Here I'm going to demonstrate Simularity's predictive archetypes on a healthcare data set. This is a data set of 28.8 million anonymized emergency department visits in the United States. And we've created this Explorer UI that lets you walk through all of the different fields of the data to decide what group that you want to model. So you can do demographics on the patient, on the hospital, things on the visit, the procedure. Today we're going to model MRSA. So let's pick anybody in our group here that got a diagnosis of MRSA. And we can easily look up the ICD-9 codes in the data here. And we can specify the metric that we want to use for feature selection. We like log likelihood, but there's a variety of other metrics that you can use here. Predictive archetype is a list of correlated features. So the correlation metric that we use determines the correlation value of the features in the predictive archetype. Let's save this and give it a name. And here's our predictive archetype for MRSA. And down here, we can see the different colors represent different types of data fields. And being a carrier of MRSA is strongly correlated with it. These numbers here are the rate ratio. So the number of times more often this diagnosis or feature occurs in the group that we're modeling versus in the general population. And some of these are quite high. Bacteremia, pressure ulcers. Over here we have a procedure, which is a smear or a gram stain. You can look through the different features here. We've got an age range of 65 to 124, and the rate ratio of that is 1.8. So people in this age group are 1.8 times more likely to be in the MRSA group versus the general population. You can also see the number of items in the group of MRSA patients. There's 79,000 of them total, and 24,000 of them are in this age group. There's 4.8 million people in this age group in the data set here. It occurs in 30% of the items. So this age group is in 30% of these people with MRSA, but only 16% of people in the general universe of the patients that we've got here. So that's how you read that information here. Now, what we can do is score others who don't have MRSA against their probability of getting it. And so let's start with an empty score here and score it against our MRSA predictive archetype. And let's pick a group of people to score. Let's pick a relatively small group so that we're not waiting too long to get the results. So we're talking about men in the Northeast who were admitted in January. And that'll be our group of people that we want to score. We can save that score here. And now we'll go ahead and run it. You press the play button here. And in real time, it's going to go out and calculate the score and tell us who in that group, men in the Northeast in January, are most likely to have MRSA. And here it gives us the anonymized patient ID and their probability of developing MRSA. And for reference, over here is the MRSA predictive archetype. And by clicking on a patient record, you can see what caused them to get a high score. And the factors are flagged here with colors. So this person's got some kidney failure and systemic inflammation. That sounds pretty bad. And those are the only things that cause them to get that score. So there you have it, an example of creating a predictive archetype and then scoring patients against it.